Cervical cancer is one of the most successfully treatable types of cancers if realized early. But still, it is affecting quite a number of women in the country and in the world as well. Here in Kenya, it is the second most common type of cancer among women. This is MEDI. Welcome and thank you so much for tuning in. My name is MAVUTI. Joining us for more on cervical cancer is Dr. Michael from KNH. He's going to be taking us through the signs and symptoms to watch out for and what treatment entails. Make sure you stay tuned. Thank you so much, Dr. for joining us.
Thank you for having me.
Yes, karibu sana. Just take a moment and introduce yourself through that camera before we proceed.
Good evening and welcome to our show today. My name is Dr. Michael NYAMBURA. I'm a surgical resident at the Kenyatta National Hospital, Othaya.
Thank you so much. So today we are going to be talking about cervical cancer. But even before we talk about cervical cancer and what cervical cancer is, it is affecting a part of the women's reproductive system called a cervix. What exactly is the cervix? Where is it exactly placed?
So the cervix is the lowermost part of the uterus. It's usually located just above the vaginal orifice. From the diagram, as you can see, this is the part we call the cervix. It's the narrow part usually enclosed within the upper vaginal orifice.
Mm-hmm. Yeah. So what is the cancer of the cervix?
So to understand the cancer of the cervix, we need to understand what actually cancer is. Mm-hmm. Cancer means new growth. Mm-hmm. So cervical cancer is abnormal growth of any tissues around the cervix. Mm-hmm. In this case, mostly cervical cancer is usually the most common type is squamous cell carcinoma. That is the histological pathology. Mm-hmm. It's classified in terms of the histological findings. It is the cancer that arises around the transformation zone of the external cervix and the internal cervix, a part called the transformation zone. Mm-hmm. Yeah.
So mostly the cancer cells will be growing.
Yeah. It starts from the transformation zone, mm-hmm, and then spreads locally, mm-hmm, and distally to other organs.
Mm-hmm. So who is at risk of maybe suffering or developing cervical cancer?
The most people at risk for cervical cancer, mm-hmm, as we said, it's a disease of women, mm-hmm, but it can also affect males. By virtue of males not having a cervix, it comes in another form in terms of penile cancer. Mm-hmm. Cervical cancer is usually caused by a virus called human papilloma virus. There are more than 150 subtypes which have been described, but some of them cause benign lesions that do not spread beyond the cervix, and others cause the malignant lesions that spread to other organs such as the liver, the lungs. So for cervical cancer, the human papilloma virus normally encountered in most of the cases of cervical cancer, we have genotype 16 and 18. They're the most virulent viruses that cause cervical cancer. And there are other viruses, other genotypes of the human papilloma virus associated with a lower risk of getting the cervical cancer. Mm-hmm. So normally what happens, the people at risk, people with multiple sexual partners, which means that person has been exposed to more of the human papilloma viruses, the subtypes, meaning they are at more risk of getting the cervical cancer. People living with HIV, they are particularly at a higher risk because of the lowered immunity in their system, by virtue of the fact that cervical cancer, the human papilloma virus is usually cleared by the immune system from the body in a normal healthy person. So for a person living with HIV, they are at higher risk of getting cervical cancer. Anyone with an early onset of sexual intercourse which means that person has been exposed to the human papilloma virus at an early age, which means as their time goes, they get more and more exposure. Also, people who engage in cigarette smoking. Cigarette smoking has been known to contain some products such as nicotine that are known to be mutagenic. They induce mutations in the cells of the cervix, leading to cervical cancer. There are other associations in terms of genetics. Some people are more genetically predisposed to developing cervical cancer. There are also other things such as race. Some races experience more cervical cancer than others. For example, in studies done in the West, you find that the African American and the Hispanics, they are higher risk of getting cervical cancer as compared to the Asians and the whites. The other factor that increases your risk of getting cervical cancer is in terms of diet. There are certain foods that are known to increase your risk. There is no direct causative factor in terms of the food, but taking that food increases your risk. Mm-hmm. Another thing is the hormonal imbalances. They are known to induce, it has been found in studies that people who have even the benign lesions of the cervix, they tend to have different reactions when they are going through a different stage in their hormonal cycle. For example, you find that people with vaginal warts caused by human papillomaviruses, they tend to increase during pregnancy. Other people with cervical lesions, whether they are benign or malignant, they become more pronounced when they are exposed to certain hormones, either during pregnancy or postpartum.
Mm-hmm. You mentioned that HPV, it is the direct cause of cervical cancer. Yeah. These others are just risk factors that could raise that your chances of getting cervical cancer. Now, when you talk about HPV, you're saying that somebody who has multiple sex partners, their risk is high. Is it that the HPV is transmitted through sexual contact?
Yeah. Mm-hmm. Human papillomavirus is usually transmitted through sexual contact. It's the most common route of transmission. However, this is not to say that you can't get it from other routes. Even other forms of sexual contacts in terms of oral, anal receptive or anal sex, they also do cause transmit the human papillomavirus. Mm-hmm. But the most common route of transmission is through sexual contact. Mm-hmm. And the downside to the human papillomavirus is even the use of the male contraception, the condoms, the barrier method, does not entirely protect you from contracting human papillomavirus.
Mm-hmm. Yeah. And the oral contraceptives that women take are used to control or enable them for family planning. Do they have a chance at increasing someone's chances of getting cervical cancer?
The oral contraceptive pills, they actually increase your risk of getting cervical cancer. Mm-hmm. The oral contraceptive pills are usually composed of hormones. And as we said earlier, the hormones increase your chances of getting cervical cancer. Mm-hmm. Any contraceptive measure does not directly affect the effect of the human papillomavirus other than the hormonal methods, because they change your hormonal balance, which then interferes with the environment of your cervix, making you more susceptible to cervical cancer. Other things such as getting recurrent UTIs increases your risk, because by virtue of for a cancer to develop, you need to increase the cell turnover. When you get an infection such as cervicitis, infections such as gonorrhea, chlamydia, trichomonas, what they do to your cervix is that the damage that happens when the infection is currently ongoing will make your body want to repair. And in the process of repair, chances are one of the cells escapes the normal cell division cycle, which makes it now it's not recognized by your immune system, as a mutated cell, which makes it develop into a malignancy, or in this case, a cancer.
You also happen to mention that certain foods will raise one's chances of contracting cervical cancer. What are some of these foods? Although they may not directly cause cervical cancer, they have a role to play in it.
Certain foods have protective factors, others have mutagenic factors. Foods rich in nitrates, such as smoked fish, smoked meat, the nitrates are known to induce mutations in your body, so you have a higher chance of getting a cervical cancer. Foods that are protective are foods rich in vitamin A and carotene, yeah. Carotene is usually found in foods such as carrots. It is a product that is known to have oxidative factors that fight off any cells that is undergoing mutations. Yeah.
So it has been said that HPV, that men are the carriers of HPV. Can you actually confirm to us if that is true, or it may be a myth?
Yeah, men are known to be the carriers of HPV, and the infection does not cause much harm to the males, other than most of them get 99% of the males, all they get are just benign lesions on their penis. They may get small warts, and that's it. But for the females, the males are able to transmit the HPV, even the high-risk HPV viruses, they are able to transmit them to their female counterparts, and the consequences are dire in the female.
So I want to move on to the signs and symptoms, or what changes to watch out for in our bodies, maybe to raise alarm that maybe you could be suffering from cervical cancer. But before we do that, is age a factor in this? Is there a certain age where someone is more at risk to suffer from cervical cancer, or it's not a factor at all?
When we speak of age, the age groups that have been seen to be at more risk of having more cases of cervical cancer, an age group between 30 to 35 years, and another peak is seen around 59 to 64 years. However, this is not to say that anyone in the reproductive age group is not at risk. Anyone who has had sexual contact with a possible infection with human papillomavirus can actually contract HPV.
When you mentioned reproductive age, is that from adolescent age?
Yeah. Reproductive age group in this case comes from onset of puberty, that is from around 13 to 45 years before the onset of menopause. But as I've said earlier, there is another peak that has been realized to happen between the ages of 59 to 64 years. The cases have been seen. That's why even when we recommend for the screening and everything, we try to make sure we cover all those age groups. Yeah.
We will get to that, but right now let's talk about the signs and symptoms. What are some of the changes that could alert someone they could be suffering from cervical cancer?
In terms of the signs and symptoms, cervical cancer is a disease that grows subtly in the body. For most people, by the time they present to a healthcare facility, most of the disease has already spread. So some of the signs to look for early, you might get vaginal bleeding after sexual intercourse. Some people do experience malodorous smells from coming with discharges from the vagina. Others have abnormal uterine bleeding, characterized by maybe heavy menses or having intermenstrual bleeds. Another group has been known to report of a feeling of a foreign body, feeling that there is something in your vagina, yet you know there is nothing. You feel there is a mass down there. Yeah.
That is the only signs. It's not going to affect the rest of the body. Mostly, it's just in that area.
Yeah, the other features now, these ones come in with a disease that has been there for quite some time, which has spread to other organs. You might get things like dysuria, which means when you are going to urinate, you find that there is pain. Others might get even bleeding with urination. Others might get features like leg edema. This comes when the kidneys fail as a result of the obstruction caused by the cervical cancer. Others might get constipation. This is when the cervical cancer extends beyond to the rectum. It leads to difficulty in passing stool, which leads to constipation. They can even get rectal bleeding. So, in summary, what to look for is have a high index of suspicion, because the signs and symptoms might be subtle, whereas the disease might still be growing inside you. Yeah.
So you're saying that for most patients, by the time they are presenting to the hospital with cervical cancer, it is in the advanced stages. By the time we are at stage 1, and of which you'll break down to us what each of these stages means, stage 1, 2, 3, and 4. But by the time someone is at stage 1 with cervical cancer, they're going to notice any changes in their body?
Yeah. What usually happens, most of the stage 1 diseases, you find them as an incidental finding. Maybe a patient was undergoing a routine vaginal examination, and you find that there is something suspicious in the cervix. However, this is not to say that there are no things that can maybe give you an index of suspicion. You might find that intercourse becomes painful. You experience your partner can even tell you that I can feel something down there. The other thing is, whenever you find that you are getting recurrent pelvic inflammatory issues, that is something to tell you need to have your pelvis checked. Another thing is, like I said, heavy menstrual bleeding. Any abnormal bleeding that has happened after puberty should warrant suspicion in anyone. Now, when we come into terms of the stages, there are some guidelines that guide on what you consider to be stage 1, stage 2, stage 3, and stage 4. Most of them, they are based on the size and what lesion you find. And by the routine screening that is usually recommended by the WHO, you are able to detect even a premalignant lesion. A premalignant is a lesion that is suspicious to you, that you know in later years this one can develop into cervical cancer. For example, you might find, like during a routine pap smear, you find that once those cells are sent for histology, you find that there is some cells with some form of changes that could easily transform into cancer. Yeah.
And you've also mentioned about the menstrual cycle and maybe heavy bleeding. But you also know that for most women, those who are using contraception, it is likely to interfere with their menstrual flow and the calendar. And also, apart from that, there are women who say that their flows are irregular. So at what point should someone become concerned and visit a hospital, and maybe not just assume this is because of the tablets I'm taking in, or maybe this is because of my mode of contraception?
What I would suggest for cervical cancer to develop from the first, let's say, point of contact with a high-risk HPV virus, it can take 12 to 18 months before any lesion changes. So within that time frame, at least we recommend for every woman who is sexually active of reproductive age, they should have routine pap smears. Because most of the time you can't tell the disease has started. But if you catch it early, you have a very good fighting chance.
Now, the pap smear. What is it?
Now let's go back to pap smear. There are different ways of diagnosing cervical cancer. In the developed countries, they've developed things like PCR, which is polymerase chain reaction. They test the human papillomavirus DNA. They take them to the lab. They're able to isolate the high risk. And for those patients, they do a follow-up. In our setup, the routine screening, this being the month of Cervical Cancer Awareness Month, in every government facility, a pap smear. It is a test whereby you go around the cervix, you come either with a spatula or a cyto brush, you go in through the vagina, you take some cells from around the transformation zone, which are then sent to the lab, and the pathologist reports on whether those cells have any features of atypia or they have any features of malignancy. This pap smear, just what it sounds like. You take cells, you make a slide, and you send them to the pathologist. That's what a pap smear is. It is recommended that for every woman of reproductive age, a sexually active woman, they can get a pap smear once annually. Throughout, for a period of, throughout the reproductive cycle, that is, let's say from 21 to 45, you can get yearly pap smears. They are free in most government hospitals. And there is also what we call a VIA and VLI. This is visual inspection of the cervix. This can be done during a routine pelvic examination. You just apply a certain stain on the cervix, and it can actually show you which cells look suspicious, which cells need something, need more investigation. Yeah? These are simple tests. These are tests that can be done during your routine visit to your gynecologist or your general practitioner, and you get the results very soon. And if there is something that needs to be done, you can actually do something about it. Yeah.
So what is the situation in our country? Women actually turning up for the screening?
Unfortunately, in our country, most women only go for pap smears upon recommendation by their doctors. And this being the month of cervical cancer awareness, I would like to put it out there. Your health is your own responsibility. It's not the responsibility of your doctor. It is your own personal responsibility. Whenever you feel something suspicious about your body, go seek care.
So let's say they come and the pap smear is done, or any other mode of screening has been done, and the results come out, and someone has cervical cancer. What next?
So if we find a suspicious or what looks like a cervical cancer lesion, the next thing is we do is staging. We also have to do some routine investigations to know, like, is this patient, has this cancer affected any other organs? Has this cancer spread to other regions? We also need to know hemodynamically, how is this person, how are they going to be able to handle the treatment that comes with this? That's what is entailed in the staging. There are different modalities of staging. In our setup, what we use is the CT scan. We do a CT scan, abdomen, chest, and pelvis. With those scans, you check the lungs, you check the liver, you check the other intra-abdominal organs, and the whole pelvic region. So you are able to stage the disease in terms of stage 1. This is a disease that is purely enclosed within the cervix, less than 2 centimeters in terms of size. That I would say is a lesion around this part, just 2 centimeters. For a stage 2 disease, it's beyond 2 centimeters, but not extending to the rest of the pelvic wall. For stage 3 disease, this is a disease. Stage 3 is usually divided into A and B, so is stage 2. In terms of size, for stage 2, we have stage 2A, which is more than 2 centimeters, but less than 5 centimeters in terms of the size. Stage 2B, it's more than 5 centimeters, but not extending beyond the pelvic wall. Once it extends beyond the pelvis, the other pelvic organs, it becomes stage 3. And stage 3 will also be divided in terms of what does it affect. Has it grown beyond the whole uterus? Ama is just going into, just within the endometrial cavity. Yeah? Then stage 4, these are diseases that are spread to distant organs. You might find it within the ovaries, you might find it within the lungs. And for 4B, not the final stage, kabisa. That is stage 4B. These are diseases that is beyond. It's a disease we usually call for palliative care. Yeah.
That it can only be managed. There is no hope for...
No. What I would like to put across, most patients, when they hear the name cancer, they think it's a death sentence. It is not always the case. Most cancers are treatable. Once you catch them early, you can treat them. For stage 1 disease, that is the, we call it carcinoma in situ. It's the disease that is localized within the cervix. This one, you can benefit from minor surgical procedures. For example, there is what we call a lip. You come in with your blade or knife and you cut off just the whole tumor. You cut it out. And your patient continues, you just follow up them. You just follow them up later to check how they are doing. Stage 2, you can also do the same. If it's still localized, it's small, but the preferred method for stage 2, if the region is beyond 2 centimeters, the preferred method is take the whole of the uterus out. Because you don't know which cells has spread to within the endometrial cavity, you don't know which ones have spread to the upper vagina, you just come and you do what we call a hysterectomy. You remove the whole uterus. For stage 3 disease, now this is where it becomes a bit tricky. It depends on how far has it spread. What can you be able to achieve with the surgery? Has it spread to the lymph nodes? Has it not spread? If you have lymph node involvement, that is a patient who might benefit from both radiotherapy and both chemotherapy. If it has not spread, if the lesion is localized with involvement of other organs such as the urinary bladder, the rectum, you still benefit from radiotherapy. You combine with chemotherapy to handle whichever cells have spread to other organs. For stage 2B disease, that is the cervical cancer that was beyond 5 centimeters, but still localized within the cervix. You can remove the whole uterus and you do what we call a lymph node dissection. You remove all the pelvic lymph nodes. This to ensure you clear all the cells that may have any cancerous cells in them. Then you can do what we call the adjuvant chemotherapy. You get about 6 cycles also, and your patient is okay.
Thank you so much for enlightening us on all of that we've been talking about. We're going to be talking more about treatment and the options, like we've mentioned, chemo and radiotherapy, but a lot of people don't exactly get what it is. But first, you're going to be taking a quick short break, and you're going to be right back. Stay tuned. Don't go away.
We murutana ni warikire kirathi gia form 4 ndugatangike ringi gwakinya ni thukuru wa guthomera kothi ya wendi waku The Abadia Technical College Karatina marihani undu waku marakumenyithia oyani wa January intake ni urathi na mbere ni mathomithagia kothi nguhi ta hospitality management kana catering, hairdressing and beauty, videography, photography, computer studies, driving school na ho ICDL. Gwakinya ni rungiriru wa mathomo ndukange nganje na ithwe kuona ntwandikithitio ni ruhonge rwa TVET na arutwo aitũ nitumateithagia kwĩgwatia attachment na kũrĩ arutwo aitũ akũraihu nĩ ũndũ wa gũkoma tũrĩ na hostels kohoro makeria tucere thukuru-inĩ aitũ mwena wa Karatina mita 500 kuma barabara-inĩ ya Karatina gũthiĩ Nairobi kũng'ethana na Brookfield Academy kana utware kũgũra thimũ namba 0726 507 444 kana rũrenda rwitũ nĩ ruo www.aim.ac.ke. The Aberdeen Technical College Karatina, aiming beyond the ranges.
Caria handũ ũngĩthomera gũkunya gita, piano kana mĩgambo nĩyo vocals. Rehoboth School of Music maheanaga mathomo ma kĩrathi kĩa igũrũ mũno. Macerere Nyeri Town harĩa opposite Naivas Supermarket kana waranĩrie nao kũhetũkĩra namba cio cia thimũ 0715 031 506. Rehoboth School of Music, cama wa rwĩmbo nĩ inanda.
Thank you so much for staying tuned in. We are here at Medicamp. Today we are talking about cervical cancer. We are here with Dr. Michael and we've learned quite a lot. But in case you're joining us, don't worry because we've not yet talked about how to prevent it. And right now we are getting into the modes of treatment. You've talked to us about surgery and you have happened to mention chemo and radiotherapy. So what is chemotherapy and when is it administered?
To go back, the surgical options become limited in terms of the modes of therapy, depending on the stage of disease. Now your options in terms of surgery become limited as the disease progresses. So as I said earlier, for cervical cancer, once disease is beyond your uterus, it's within the pelvis, now you need to think of other ways to control this disease progress. And like I said, cervical cancer, it's not a death sentence. It is treatable, it's curable. Depending on what stage your disease is, for stage 1 and stage 2 disease, we said surgery is the best option. Depending on what your gynecologist finds in terms of the CT scan staging, that is what will determine the type of surgery you will get. Now, for chemotherapy, the regimens, these are drugs that are designed to kill off the cancer cells. And most of these drugs, they are quite toxic to the body. They are somewhat more targeting to the cancer cells than to the normal cells in the body. Most of these compounds are cisplatin based. Cisplatin is a chemotherapy drug that has been found to be quite effective in the management of most of the cervical cancers. You use different regimens depending on what the histological type of your cervical cancer is. And the other option is radiotherapy. Radiotherapy is whereby you irradiate the tumor. And there are two types of radiotherapy. You can have like the whole pelvis irradiated, or you can have something we call brachytherapy. This is a more targeted radiation. This whereby, to illustrate with our diagram, let's say this is our lesion. This is the lesion I want to cure of cancer. I get my rays, I direct them directly to this thing, you burn it off. And for each treatment, there is its own complications. For example, for surgery, it is a surgical procedure. You can get any bleeding, you can easily get anesthetic reactions, you can get infections. For radiotherapy, the main complication is, in as much as you're irradiating the cancerous cells, some cells won't be innocent by standards. You find that some of the normal cells will also get some damage. You find these people experience a lot of swelling around their lower limbs. You get their skin thickens around the pelvis. Becomes hard, more like plastic. The skin becomes like a plastic That is some of the side effects of radiation. When we go to the chemotherapy, this one has a myriad of side effects. But what we usually say, the benefit to risk ratio is much higher. You have more benefits than the risk. Yes, you might lose your hair, you might experience diarrhea, you might have vomiting, you might have nausea, you might be unable to feed properly. But these things will be able to control the main risk that comes with cervical cancer, which is bleeding. Most of the time you find that with advanced stage disease, bleeding becomes the major risk and the major health concern. Because these patients, you can't be transfusing daily. We don't have that capability in most of our government hospitals. So you find that these patients, you keep on transfusing today, the day after, unless you're able to control that bleeding, even for the disease that has spread to the other organs. Now this is where we do both radiotherapy and chemotherapy. You combine them. Let's say the disease has spread to the lungs. I can irradiate the primary disease in the pelvis, and I give systemic chemotherapy in terms of the cisplatin-based regimens that circulates in the whole body and kills the other cells, the other tumor cells in the system. That way, you're able to improve the quality of life of your patient. You're able to have most of them, they're able to have some form of dignity in their living conditions at home. You find that most of these tumors, they smell badly. Some of them bleed awfully. And being as a caregiver to a patient suffering from cervical cancer, especially the advanced stages, becomes a challenge. I've seen cases of whereby the whole of the cervix has been eaten away. And you are there wondering, how do we achieve some form of dignity for this person so that they're able to take care of themselves? That's why I said, any cancer, it's not a death sentence. Just needs your own positive attitude and willingness to fight that disease.
Thank you so much for that, Doctor. And while we're talking about radiotherapy, you mentioned that it might affect some of the surrounding tissues, and the skin might become as hard as a plastic to some extent. How is that managed? Do they have to deal with that for the rest of their life, or does it go away with time?
Most of it does not go away, because the changes that happen to your, let's say, the subcutaneous tissues, your skin, those changes, some of them, they become permanent. And by the time we are opting for radiotherapy, this means the disease has already spread. So losing the elasticity of your skin is a small price to pay for the sake of your life. What happens, like, if unfortunately for most of the diseases that need radiotherapy and chemotherapy, the advanced chemotherapy, you are not able to eliminate the disease completely. So most of the radiotherapy is aimed at controlling the symptoms such as bleeding, the pain. That's the purpose. So we usually say it's a small price to pay for the sake of a more dignified living condition.
And you're mentioning that most of this is going to happen in advanced stages. So do you think our women fear to come for screening? Because if they come for screening, this could be detected early, and a surgery alone can be able to solve that. Do you think that women fear to come for the screening because maybe it could be a little bit uncomfortable?
What I know from my personal experience is that the whole idea of a cancer has been negativized by our society. It has a lot of stigma around it. So most people fear that whenever they feel like, I might be fearing that I have a cancer. So what they do, they don't seek care. But the procedure is not usually painful. You can get a local anesthetic if you feel uncomfortable. And within 2 minutes, the procedure for the screening is done. You don't even know whether it happened. In some facilities, there is even an option of getting anesthesia. If you feel the procedure to be uncomfortable for you, you can actually be anesthetized. And you undergo the procedure, you get screened, you just have to repeat the procedure maybe after a year or two. In that way, you are giving yourself, you are able to be in charge of your own health. Yeah.
And I want us to talk about prevention, if it is possible to prevent cervical cancer. But then Afan is asking, this part of the skin that is becoming plastic-like, is it numb, is it painful, or is it just normal?
It's not usually painful, just a hardened skin. It loses its own elasticity because with the burn, it's like something that has been burnt but is still living. Yeah.
So there is no pain.
There is no pain.
Just like the
The
rest
whole
of the skin.
radiotherapy, the idea for the radiotherapy is to control the pain. You burn out the bad cells, you control the pain. Yeah.
Okay, so can you prevent cervical cancer?
Yes, cervical cancer is 100% preventable. Currently, especially in the developed countries, they have some guidelines whereby there are two pharmaceutical companies which have been producing vaccines. One of them is Gadarix, and the other one, there is another one called Cervarix. These vaccines, anyone between the ages of 13 to 27, they are eligible to get these vaccines. I remember there was a time there was a heated debate in our system when it was recommended that all ladies, all young girls who are in high school to get the vaccine. So cervical cancer is preventable. The other thing is to eliminate the risk factors. On top of using the vaccine, you can try and avoid the risk factors. Having multiple sexual partners, that one you can control. Be faithful to one partner. In as much as using barrier methods is not 100% effective in preventing, you can still use the protection because the other STIs increase your risk to having a lower immunity. The other thing is your diet. Eat diets rich in vitamin C, vitamin A. These ones help to oxidize the cancerous cells. I think the other thing is having mass awareness. The first step to preventing something is people being aware of it. Have mass education of the population. Let people understand what cervical cancer is, what are some of the signs and symptoms, what to look out for, why they need these vaccines. Let them understand why they need this annual screening or 3-yearly screening. Yeah, and that way we'll be able to control cervical cancer. In the West, these measures have been quite effective. They were in the US between the years 2009 and 2015. They were able to reduce cervical cancer deaths by 70% through pap smear, screening peke yake. And then when they combined with the vaccines, the incidence of cervical cancer reduced by more than 80%.
And you're mentioning that this HPV vaccine, it is available in our country. But how many people are coming to get this vaccine?
So far, I don't even think you find it in most government facilities because people don't come for it. So most of the stocks that were there, some of them expired.
That is sad.
But now the purpose of having a month like this one is for people to be aware these vaccines are available. Just that the consumption is not there. People are not coming for these vaccines. They are available in the government facilities, but people don't go for them. And it is our job as healthcare workers to make people aware that this is not something that we should be struggling with in the 21st century. This is something that we have made tremendous steps in terms of controlling it. All we need is now for people to know what it is, to accept the steps we are taking, so that we can be able to go through the journeys together. Yeah.
So do you think the Ministry of Health here in our country and the government at it, do you think they've done enough to maybe educate people or make them aware that especially there is a vaccine that could totally prevent cervical cancer?
I know the Ministry of Health is doing quite a lot. We have several camps. You find even in the private facilities, they are holding medical camps trying to make cervical cancer awareness. And not just cervical cancer, even the other preventable cancers, the other treatable cancers. Yeah. I know the Ministry of Health has invested quite a lot, but we are still not yet there. There is still much to be done. Yeah.
So in this particular month, what have we been able to do to push this narrative forward to make people aware that there is a role for you as a person, for you as someone who could suffer cervical cancer in future? What have we been able to achieve within this month? Have we done anything yet? Have we done a lot?
What I can say we've been able to take in this month with there is a Kenyatta National Hospital is holding almost daily webinars whereby we are educating the public on this cancer. So we hold them mostly in the afternoons. We are able, and the platforms are usually open even to the public, not just the healthcare workers, even the public. They're usually invited. And for this month, I would say we've seen quite a rise in the people coming for pap smears. More women are being more aware of their own health. We are finding even in the outpatient department, a woman just comes in and tells you, I had there is a test that I can undertake to know if I am at risk of getting cervical cancer. And you're able to undertake the test. And this is actually a positive change. Even the attitude that people used to have, even the caregivers of sufferers of cervical cancer, the attitude is changing. And I feel like if we could have more of these outreaches, we can be able to combat the cervical cancer and have a much better and much healthier population.
So is screening free, or is it, do people pay for it, especially in government hospitals? Could it be that the prices are scaring people away?
Screening, the visual inspection, the VIA, LI, those ones are free in the level 4 tier hospitals. That is the hospitals that are the sub-county hospitals. And even in the lower facilities, they're usually provided for free. Any government facility, level 4, level 5 actually, from level 5 going downwards, the screening is free. You actually find even some private facilities have taken it upon themselves to offer the service for free. All they ask you is to pay if you need the treatment. Or some others ask you to pay for if you're getting a pap smear and they have to send the sample to another pathology lab, they ask you to just pay for the lab services. Yeah, because this disease is affecting our women. It's affecting our future. So we need to come together to fight it.
Yeah, from what I'm getting, it is that our hospitals here in our country, you're doing quite a good job, and people can actually jump into the challenge and now do our part. We as people, I think we have a lot to do as women. We need to just walk to the next clinic, because these services you're mentioning that they are offered free of charge. So just walk into the next clinic, a public one for that matter, and you will be able to get these services for free, and we will have done a lot in helping us combat cervical cancer. So as we went up, do you have anything else you want to add on top of what you've been educating us on today?
Maybe a parting shot. Cervical cancer, it is a totally curable form of cancer. And there are many other. treatable cancers. You just need to recognize it early. So the next time you feel your body is telling you something, the next time you experience some form of discomfort, just go to your doctor. It could save your life.
Thank you so much. Anyone want to say hi to? Anyone want to send salams to?
And maybe just to my patients, my family. I love you all.
And here at Medicamp, we are so much grateful for you taking the time to come and educate us together with our viewers on cervical cancer. So it is not yet the end of the Cervical Cancer Awareness Month. So you can't start on working on what you can work on right now in regards to combating cervical cancer, like get the screening done. So that's why you're going to be wrapping it up. And thank you so much for taking your time to tune in and to learn with us. See you in our next episode. And don't forget that your health is your wealth. I have been your host, MUMBI MAVUTI. See you.
Thank you.